Thank you all for joining us today. I'm excited for our session, and I'm very happy to welcome you all to our next session. This, I think, is our fifth session in the Campus Compact Impact Award Series. For those of you that don't know me, I'm Laura Weaver, our Director of Professional Development, and I, again this year, am your host for our series. Each year, Campus Compact celebrates shining examples of meaningful, impactful civic and community engagement that really highlights the work being done by presidents, faculty, community engagement professionals, students, and programs and partnerships that illustrate positive impact higher education can have for the public good happening at our member campuses across the country. In today's session, you will hear from Aisha Cole and Alicia Santilli. I think I have that correctly, Alicia. Great. From Southern Connecticut State University, which is one of Campus Compact's 2026 Excellent in Civic and Community Engaged Partnership awardees. And being from Connecticut, I have heard a lot about from my former supervisor, Matt Farley. He likes to talk about all of his Connecticut and Southern New England institutions. So, Aisha and Alicia, I've heard a lot about your program from Matt. Alicia is the Senior Director of Community Initiatives and oversees a variety of initiatives, including the program that's going to be highlighted today, which is the Community Alliance for Research and Engagement, referred to many times as CARE, where she was also the founding staff member back in 2007 and served as its director until 2024. Aisha serves as its director now, and as it is within the College of Health and Human Services. She is a native of Memphis, Tennessee, and recently moved to Connecticut. So she's really kind of getting her feet there on the Midwest. Aisha, I understand, as a Midwestern girl myself, I would need a little bit of time to get used to Connecticut. She first took a role at the University of Connecticut before transitioning to Southern Connecticut State University, where in addition to directing CARE, she also oversees the CDC-funded program REACH, which emphasizes chronic disease prevention by focusing on nutrition, physical activity, and breastfeeding. Now, I'm really excited to hear more from Alicia and Aisha about CARE and its partnership between the Yale School of Public Health and the New Haven community. And from what I've read, it's a community engaged center dedicated to advancing health equity in New Haven, and it works to improve health among its residents most affected by inequities, particularly Black and Brown communities and low-income populations. It is something that I know a lot of communities across the country could really utilize this model that you all have put in place with the partnerships. Being outside of Indianapolis, really thought a lot about, oh, this is something I can see a lot of institutions, maybe right here in Indianapolis doing, but many institutions across the country really taking note of the partnership model that you have in place and the model around the programming. CARE really carries out its mission through two major initiatives, both of which I'm excited to hear more about, that I think we're going to hear more about. One is that racial and ethnic approaches to community health, or the REACH program, which Aisha oversees and is funded again by the CDC. And then the CARE Health Leadership Program, which trains residents to become leaders and partners in shaping local health initiatives and research, which is something that I personally, as the nerd that I am, that most people know, am really also very excited about. I also know that in 2027, CARE will be celebrating 2 decades of trusted collaboration, and I'm certain that it will continue to build sustainable, community-driven solutions that move New Haven closer to health equity for all its residents. Again, you all did not come here to hear me talk about the program. you came to hear Aisha and Alicia talk about the program. So without further ado, I'm going to turn it on over to them. And I'm looking forward to our Q&A session afterwards. So Alicia and Aisha, it's all you now.
Thank you so much, Laura, for that great introduction. I really appreciate it. So as Laura mentioned, I'm Alicia Santilli. About partway through this presentation, Aisha will step in, so you'll hear from her shortly. So today we're here to talk about care, as Laura mentioned, and our 19-year journey toward health equity in New Haven. It's hard to believe that it's already been 19 years, and we will be celebrating 2 decades next May. So our next slide, please. Our objectives for today are to identify strategies to develop and sustain cross-sector community-driven initiatives, analyze the characteristics for those long-term trust-based partnerships, and assess strengths and opportunities and pitfalls within community university initiatives and partnerships. Next slide. So we're going to present care as a case study and give you, so my role today is to give a little bit of the history and background of how we developed over the years and how we got to where we are today. And then Aisha will take over and tell you all about our current initiatives. So next slide. Our mission in New Haven, our mission at CARE is pretty broad. It's to improve health in New Haven among people most impacted by by disparities. Here in New Haven, which is a pretty typical small city here in New England, that includes our Black and Brown communities and, of course, low-income populations. Our vision is to have thriving communities that foster health and well-being for all people. So as I mentioned, we're about to come up to our 20-year anniversary next year. And we started in 2007 at the Yale School of Public Health, and I'll give a little bit more history behind that. And in 2016, we started a partnership with Southern Connecticut State University, which now serves as the anchor institution for the past. We're about to, in September, reach our 10-year mark being at SCSU. And it's been a really fantastic partnership. We still have a partnership with YSPH, Yale School of Public Health. They focus on all of our research, running most of our research and evaluation activities, whereas at SCSU, we're focused on the programming, the engagement with the community, and the operational aspects of running care. So just a little bit about how we're set up. Next slide. For most of the time that we've been in existence, we have really focused on, in the public health world, something that we call policy, system, and environmental change, meaning built environment. And we've mostly focused on chronic disease prevention. We did have a couple of years where we focused on infectious disease with COVID. But for the most part, our focus has been on chronic disease prevention and specifically nutrition and physical activity initiatives out in the community. But we do a lot of this work through coalition building and community engagement. And again, with that focus on policy, system, and environmental change. So in public health, we often think about people's individual behavior change, how much, exercise they get, how healthy they're eating in terms of preventing chronic disease, but really going beyond that and thinking about how are our communities set up, particularly those communities that have been divested in over long-term periods of time. How are they set up to ensure people can engage in these healthy behaviors? So that's our main focus. Next slide. Actually, you can skip right along. So I'm going to go over a little bit of our care history and how we got to where we are through patience and persistence. I love alliteration. And I feel like that really underscores what's needed to create a positive and productive partnership between universities and communities. So when we started out back in 2007, we really spent our first couple of years really trying to be in community, with the community, we got a pretty strong directive. We spent time just being present and listening. We joined different committees and coalitions led by the health department, our local hospital, which is Yale New Haven Hospital, different community organizations and neighborhood groups. And we really wanted to hear, as we were coming in as Yale at the time, we really wanted to hear what the community felt were the most pressing community and health issues. And we got a very clear directive from the community. And their message was, if you as Yale are going to come into our community, you must focus on the neighborhoods in New Haven that have historically been divested in and have experienced the greatest socioeconomic disparities, which has driven the huge health disparities that we have in our communities. So we took that very seriously, and most of our work even today is really focused we focus on all of New Haven, but we really pay special attention to those communities that have been historically divested in. Simultaneously, we're hearing from community partners and residents about health topics that concern them most. And things like heart disease, diabetes, blood pressure kind of rose to the top, and that's how we got our chronic disease focus. One other thing that came up in those early years, our community partners, particularly the health department and the hospital, expressed that we have a really weird government here in Connecticut. We don't have county government, but we have a lot of county level data, which doesn't really tell us a lot about our cities. It's not particularly useful. So we got a very clear request from our community partners that we've lacked granular data at the neighborhood level that really helps to tell us what the major health issues are and the root of those health issues. And so they expressed an interest in us collecting data. So over from 2009 through 2015, we conducted a triennial health survey in what are considered our 6 quote unquote low income neighborhoods. At each time point, we collected 1,200 surveys from randomly selected households. And importantly, we trained community members. I have a community organizing background, and I found it interesting that in traditional research, if you needed to collect 1,000 surveys, you hire 1 or 2 research assistants and collect that data over like a year. And so we had a lot of conversations internally. Why don't we hire a bunch of people all at once and collect the data over a short time period? So we did just that. And that actually formed a lot of the kind of basis for our Community Research Fellows program, which Aisha will talk about in a couple minutes. Next slide. So we were really proud of this model where we trained community members from the surrounding communities, either from New Haven or have lived in New Haven, maybe live just outside the city, but still kind of and from New Haven. We train them on research and how to collect surveys, how to do that without bias, and taught them about how to randomize and what that means and having a representative sample and all of that. We collected the data really quickly and were able to produce reports. One of the things that we felt really strongly about is making sure that we were giving the data right back to the community so that it could inform their decision making. So we were producing community reports from like December through March and presenting to community groups and reporting back the data and asking them what they wanted to do and what kind of action that they want to take. And then in the intervening years, next slide, we worked closely. Actually, the next couple of slides are examples of our dissemination. So this is one of the community forums, the flyer for the community forum. That was our health director at the time in the bottom left picture. Next slide. And this is one of the community reports that we produced. So we did not prioritize academic publications. We did eventually get around to it. We really prioritized getting the data out to the community and disseminating those results quickly. We took a lot of action. Next slide. We've gotten really, really involved. One of the things we learned from the data was the severity of the food insecurity issue in these particular neighborhoods that we were focused on. So approximately a third of the households had reported food insecurity at each time point of our survey. So that really spurred CARE as an organization to get involved in food insecurity because we can't tell people to eat healthy if they don't have money to buy healthy food. So we've done a lot around food insecurity, which Aisha will touch upon. Next slide. Also, during those intervening years, we had a team of community organizers, and we all were assigned to those different neighborhoods, and we worked directly with the community to learn what they wanted to work on, what health issues, basically, what was the intersection between community issues they were working on and health issues, and how could we support that work moving forward. So it was really about showing up, listening, and figuring out where that intersection was that was of most benefit to the community without bringing a huge agenda of our own. Throughout this process, we built capacity, fostered ownership of projects, and developed leadership. And this served the basis for our community health leaders program, which again, Aisha will talk about in a minute. Next slide. So this is just some examples of some of the types of initiatives we worked on in those intervening years. We have contributed to probably about 20 community gardens at this point, if not more, which has been really exciting and fulfilling. And then we've done some more traditional kind of health programming like fitness classes and cooking classes. Those are always in high demand. Next slide is just a picture of a marked walking trail that we helped develop in our Fairhaven community, and one of our community gardens, which is a flourishing community garden today. And so from here, I'm going to pass it over to my wonderful colleague, Aisha, to talk to you about where we are today.
Thank you, Alicia. I kind of feel like I pushed you along because I hit the button too soon, but we're doing good on time. So Alicia shared nicely the history of CARE, and it's a perfect transition to talk about the work and the programs that we are implementing with CARE today. As it was mentioned earlier, Alicia was previously the director of CARE. I've been the director of CARE for 2 years now, and I've had a wonderful time getting to know the people in New Haven, getting to know the city, but also implementing the programs that are so meaningful within New Haven. I'll start off with sharing about our Care Health Leadership Program. The Care Health Leadership title is the umbrella word to describe 2 leadership programs that we have. We have our Community Health Leadership Program, and we have our Community Research Program. Both programs are a cornerstone of the initiatives and the work that we're doing, and it really centralizes the community and connects them to the programming and how we think about implementing programming within the city and engaging within the community. The Care Health Leadership Program has been able to have 19 cohorts since 2017. And within those cohorts, we typically have about 15 people to participate, and we've trained 217 residents. There's an experimental component for our Community Health Leadership Program. And from that project alone, we've had about 41 community events throughout New Haven, and we have reached a bit over 1,700 people in New Haven. In 2023, we expanded our Community Health Leadership Program to Hartford, and in 2025, we expanded our Community Health Leadership Program and our Community Research Program to Bridgeport. So here I will give a little bit more detail differentiating the 2 programs. With our Community Health Leadership Program, it is an opportunity for us to help facilitate residents around leadership, sharing with them what health equity is, exposing them to what public health is, and helping them to identify themselves and what type of impact they can make within their community. We train our participants for both programs for about 9 months. We have about 13 or so sessions, and with some of those sessions, we have people to come in and co-facilitate or to lead some of those sessions. Some of the alders within the community will come and present, and we also have an organization called Data Haven that joins both of the programs to share data that's specific to the Black and Brown population in the areas that we serve within New Haven, and it has since expanded to Hartford and Bridgeport. Now, when we think about our community research program, research fellows program, it's a little bit different because it is a research focus. We know that traditionally and historically, there is stigma between research and the Black and Brown community. So with this program, we make an attempt to bridge the gap between community and research. And we look at the community research fellows as experts, right, around the work that they are doing or who they are within the community. And we pair them with principal investigators who are already working on research or preparing to work with research, and obviously identifying the principal investigators as experts of the scientific piece. They come together and share information. It's a bidirectional relationship where they are learning from each other. The community research fellows are able to share different things with the researchers, like identifying language that may need to change on surveys, or helping them to connect with certain populations or group within the community to share education around different cancer topics and such. And at the end of that program, they create a poster where they are presenting on the research that they are that they have learned and the work that they've done with the researchers. For our community health leadership project, I mentioned that there is an experimental component, and we provide them coordination and funding for both of the programs to be a part of the community health leadership program. But with the project and the experimental piece, we allow them to develop a program or an initiative, sometimes around the topics of chronic diseases, or it can be mental health, whichever way, that is fitting or desirable to the health leaders. And we provide them support around also surveying when they are implementing the projects. And that's where we see the partnership with the Yale School of Public Health. I also want to share that with the program for both community health leaders and community research fellows, we are intentional to recruit within the cities where we are implementing the project. So we have New Haven residents to be a part of the New Haven cohort. We have Hartford residents to be a part of the Hartford cohort, and then the same for Bridgeport. Although they are going through the program separately, we look at it as satellite sites where the care team is the foundational site, and we provide our partners in Hartford and our partners in Bridgeport with the support that they need to implement the program. So it's more of a train the trainer process that we have. I'm now going to show a video of one of our alumni who graduated from the Community Health Leadership Program, and you all will be able to see how her project sustained even after the completion of the Health Leadership Program.
This is Ariella Edwards.
And I am a New Haven health leader. No, I'm not a therapist. I'm not a doctor. I did not study psychology in school. I am just a regular citizen that is concerned.
Ariella was motivated by kind of helping people heal from the brokenness they experience through life, regardless of where that came from.
I grew up at 201 Franklin Street, apartment 1303. Violence, a lot of drug activity. In my community, I see that a lot. My family, we had a lot of addicts, and I have my own issues growing up. Unfortunately, our people, Black and brown people, we often shy away from counselors and even talking about certain things. It was just like you knew what happened, and it was like you kind of move forward. But I want to know, I want to get to the bottom of our issues. So this is where it happens. It looks completely different when there's no one here. So I created an annual mental health fair. You get resources and referrals to mental health services. There is local artists performing, singers, dancers. And then we also have speakers, doctors, licensed social workers, therapists, and some of them are regular people like me who just have different experience and they are fighting for their people and for their community.
And I'd like to read this proclamation of the City of New Haven. We at the City of New Haven declare New Haven Mental Health Awareness Day this year as organized and founded by Ariella Edwards and join with the community in supporting initiatives created to help New Haven. Thank you so much.
What impressed me most about Ariella was her transparency. I think Ariella really came as her true self, and she was clear on what she was looking to do and that she was nervous about it, and it was her first time, but she definitely put her all into it, and she was willing to help any and everyone around her do the same.
The New Haven Health Leaders Program let me know that even though I don't have a degree in public health, anyone can push forward.
Public health, it's personal. You are a representation of the community, and that is all you really need to be a part of a program like this.
So as I mentioned, Ariella is one of our alum, and she continues to implement this initiative in New Haven. I'm going to now transition to another program that I oversee at CARE. This was mentioned earlier, our REACH program, which stands for Racial Equity Approaches to Community Health. This program is funded by the CDC. Our first round of REACH funding came in 2018 until 2023. It's typically a 5-year grant. And the focus of the REACH program is to reduce chronic disease burden and health disparities amongst the most vulnerable populations. As we've mentioned in New Haven, we have 6 priority communities or 6 priority areas where, as Alicia said earlier, that's been divested in, and we are intentional to implement our REACH work as well as our community health leadership work within those areas. I'll review with you all the focuses that we have with our REACH program. So for the first year, we focused on nutrition, breastfeeding, active transportation, and there was also an opportunity to do some of the COVID work, but since then we have not been refunded to do the COVID work. So with our nutrition work, one of our most empowering programs is our SWAP program, supporting wellness at pantries, and it promotes healthy food choices within the pantries that we partner with within New Haven. I like to explain this program because it's very simple but also impactful. We look at this as a stoplight program. We know that with the stoplight, the letters or the colors of the stoplight, it indicates something. There's something there to let us know, what's working well, what's not working well, and where we need to slow down. So with the pantries, we train them on labeling food within the pantry that indicates red, which is food that you probably need to stay away from. Those foods are high in sugars, foods that are high in salt and such. And then we are labeling foods in yellow. So that's food that you probably should choose sometimes, eat in moderation. And then we label foods in green. That indicates that these are healthy foods, foods that you should have often. And that's typically the fresh fruits and vegetables, or obviously foods that are low in sugar and low in salt. So as of today, we have 10 pantries. We actually have more than that. I'm looking at this. As of today, we actually have about 15 to 16 pantries who are trained on SWAP. And because these pantries are, again, situated within New Haven, this program serves a total of 25,000 people per year. And that also speaks volumes to how many people, how many communities each of our pantries are serving. I'll now talk about our breastfeeding work. Our breastfeeding program, Anytime, Anyplace, is a citywide awareness campaign where we are working with local organizations and businesses, educating them around the state laws when it comes to breastfeeding. And we are encouraging them to have a safe space for their staff, their personnel, and for people who are coming to their organizations to be able to comfortably breastfeed. As of today, we have 79 local businesses who have signed up to be a part of Anytime, Anyplace. And 6 of those businesses have received the recognition as a breastfeeding friendly work site. And that recognition is them putting in a formal plan in place, and that's recognized by the state of Connecticut, which allows them to get the recognition through Anytime, Anyplace. Under breastfeeding, we also have our Roots of Racial Inequities in Breastfeeding training. This training is targeted towards clinicians, providing and sharing with them the history of breastfeeding, specifically within the African American community. And it also kind of puts the onus on clinicians to take a little bit more accountability when it comes to encouraging families to breastfeed as opposed to formula feed. As of today, we've trained over 260 participants from the healthcare lens and also the academic lens as well. And we also have our active transportation work. Previously, in the first grant year of, or the first cycle of REACH, we collaborated with the City of New Haven Transportation Department to establish and support a Safe Routes for All active transportation plan. And this plan has been implemented since then because we're now in our second REACH funding cycle. And this allows the city to address different areas, especially those priority those priority neighborhoods that will help to build infrastructure where people can increase their physical activity. The Board of Alders here in September, they passed the official active transportation plan, and now we're able to see some of this work being implemented through our quick bills. And those quick bills are established in many different ways. For example, just last summer, we were out within the community helping to repaint the lines that indicates where people can safely walk, or helping to put, we love to say this word, chicanes in certain areas so that cars can make wider turns so people can feel comfortable with walking, biking, and using transportation. And I will pass this slide to Alicia. This is our CPAN work.
So I mentioned that CARE does quite a lot of work around food insecurity with a variety of coalitions in New Haven. We have a food policy council that focuses more broadly on food and food systems and a little bit on food insecurity. And then when we got our first REACH award in 2019, there were some fits and starts of other kind of committees and coalitions around supporting the organizations that work to address food insecurity, so our food pantries and soup kitchens. And there was really an acknowledgement over and over again from the community that they needed help coming together and looking at the whole food assistance system as a whole. And we found through some research that we were doing that not only were the food assistance organizations interested in accessing more healthy foods in their pantries, the guests had been asking for it over and over and over again. And then there were other systemic issues. For example, like at one food pantry, somebody would come in, that food pantry is only open once a month. So they're asking, do you know where else I could go? And the other food pantry doesn't really have a sense of where the other food pantries are and when they're open. So we brought all the food assistance program, well, not all of them, but we brought many of the food assistance programs together to create this coalition CFAN. And it's been very, very successful. And we've done quite a lot of work over the past year since 2019. And one of the things we've done more recently is advocate with the City of New Haven to include food assistance in our budget, in our city budget. I say our because I live in New Haven, longtime resident here. So my tax dollars, asking for some of that to go towards food assistance programs. Historically, that's not something that the city had invested in, even though they invest in other services like services for unhoused individuals and senior services and things like that. So we have been able to, for 2 years in a row, get about $500,000, Well, that's about $350,000 per year. And then there's a separate process that brought it up to $550,000. And so that has been a really huge advocacy win for us as a coalition. And we're really, really proud of that work. And that work has been supported by CARE and through our REACH funding.
So I'll show another video for you all to just get like an impact or an idea of how the REACH program has impacted New Haven.
Collaboration improves community.
We've made our neighborhood better. Not just one person, but a whole neighborhood.
Because of REACH, there were partnerships established that may not have been without it.
Everybody working together, and God bless for doing so much for so many.
Some of our clients who are suffering from diabetes and hypertension, ask them what their life would have been like prior to having this pantry to what it's like now, being able to have healthy choices. Ask them.
You can't run the world on an empty stomach. It's a basic human right. Food is a right, it's not a privilege. Food should be accessible to all because everybody needs it, so everybody should have it.
Awareness in so many different arenas, with families, with medical providers, with business owners who perhaps do not have or are aware that it is a law in Connecticut that you have to provide provisions for a birthing person to breast or chest feed. Yeah, I've really been proud of that because it's such a ripple effect and it's made such an impact in so many different spaces.
It's interesting. The goal of Safe Routes for All is to get the transportation sector to be a background noise where residents can cross the street to get their groceries, to pick up their mail, to go to the bank, to go to the dry cleaner, whatever it is you're doing, but it doesn't have to be a focus of your day. Because of REACH, New Haven has completed its Safe Routes for All citywide active transportation plan. And because of REACH, the city of New Haven is poised to take in millions of dollars in federal grant programs.
REACH mattered because it changed lives.
we had the opportunity to go out to the community with our community health workers and really have conversations and bring people into care, into primary care, and also addressing other social barriers. I honestly don't know what would have been of all those almost 300 families we served if it wasn't for the REACH and the CHW support.
Funded to us allowed us to show up in the neighborhoods, to work with churches and neighborhood civic organizations, to provide clinics, to be able to give quality care, improved access through the REACH grant, which vaccinated, tested, and even went on to provide flu vaccinations. It was just, those neighborhoods are much healthier today because of the REACH grant.
Work well done. This is what health equity looks like. So, congratulations to the REACH team for all that you've accomplished. The power of partnerships being brought to bear to make difference that is lasting and meaningful for our neighbors, for communities, for the next generation. More work to do. I can't wait to see what comes next.
So we certainly want to give you all the opportunity to ask us questions. So I'll try to end this. I mentioned starting off that we received our first cycle of REACH, and now we are in our second cycle of REACH. And we always put fingers crossed or say fingers crossed because this is CDC funded grant. This is a CDC funded grant. And when you think about the name Racial Equity for Approaches to Community Health, we have felt a bit of the impact of the change politically today, but we are happy to say that we are still moving forward with our programming. And I just looked at the video. I'm telling you all, I've seen this video a million times at this point, but every time I look at the video, I think about how this video was done before I came into the role. But I'm able to see community partners and able to see community consultants in the video that we are still working with and partnering with today. And that really speaks volumes to our community engaged work. So just impact, we like to share numbers. Numbers really kind of help, drive the story. But so 218 residents completed our 17 cohorts of care. That earlier with the Care Health Leadership Program. 17 food, this is the updated number, 17 food pantries participate in our SWAP program. And I just want to add really quickly here that we've even expanded our SWAP program. We were focusing on pantries only, but just recently this year, we've expanded to share the SWAP training with soup kitchens. So there's more to come with that. And 654 healthcare professionals have been trained on the Roots in Racial Inequity breastfeeding program. We've even expanded there. We have now trained, I believe, 6 of our community members and community partners to be able to facilitate this training with us. So that helps with getting more information and education out there around breastfeeding work. And then $13 million in grants and contracts we've been able to accumulate and sustain. So that's a hand clap to the work that we're doing on the REACH side, especially a lot of this was led by Alicia, but a bigger hand clap to the New Haven community who has allowed us to work with them in partnership to be able to implement the programs and activate the ideas that they are sharing with us to make impact. That's a perfect transition into patience, persistence, consistency, and how this all works for us on the care side. We're big on community collaboration, and this work can only, be able to sustain based on the type of relationships that we've managed within the community. So we are intentional with partnering with people who may be working for grassroots organizations or smaller organizations by sharing the wealth. We just talked about how we've accumulated $13 million dollars or more funding, and we share that with our grassroots organizations and our partners. When we are working with community members, we are sharing power with them as we are making decisions, identifying what the need is within the community based on what we have heard from community members and not what we believe or think is best. And we show up consistently. And when we talk about showing up consistently in the community, being immersed in what's happening in New Haven and not being in the community or showing up, with a calculated motive, but genuinely working within the community and showing up to different events and programs to build that relationship. And we have a steering committee that we meet with every other month, and we make sure that we are engaging with community members on the steering committee, paying people for their time, identifying that there's a lot of time taken away from your family, taken away from your day to day, to engage with us, to guide us. So we just want to make sure that there's an equitable relationship there. And then also acknowledging that we are a large institution. So we know that we show up in these spaces, understanding that they're looking at us as the ones with power. But I just want to reiterate that even in that, there is shared power in the work, because we simply would not be as impactful without engaging with the community and receiving their feedback, listening to what they are saying, and then developing programming based on what the community has shared. And I'll go through this quickly, but we want to avoid pitfalls by being transparent. And that's such a big thing within the community, even being transparent about grant dollars, being transparent about staffing, being transparent about what you need and what you would like to do. And just being humble enough to listen to what the community is saying, being open to pivot or make changes around your programming if it's not aligning with what the community needs. And being able to also disseminate information back into the community. Alicia mentioned earlier on with the history that we went out to collect surveys and get feedback from community members, but it's equally important to share that information back out to the community. And that holds accountability on both sides about, what we're asking for and what we feel like it's owed to you as community members, and sharing resources. And resources doesn't always mean, sharing funding, but as a larger institution, we have access to different resources that smaller organizations or grassroots organizations may not have. So just being open to sharing that and pushing their initiatives, again, it should be bi-directional. And then advocating. We're big advocates for policy. We have a policy system environmental change lens, and we want to ensure that, again, we are not pushing what our needs are onto the community, but we're listening to what the community needs are and developing programming based on what the community is sharing. And I'll pass it to you, Alicia.
Just really quickly, I hope that our message today is patience, persistence, and consistency. It takes a long time to build these relationships and foster trust. So being in it for the long term is really the way to build community partnerships. And I recognize that we only have, I think, about 8 minutes left. And so I really want to make sure we have a little bit of time for Q&A. So we can go ahead and open that up. Laura, I assume you'll be facilitating that piece.
Yes, sorry, I was trying to find my unmute. So yes, for everyone, we can use the shared hands function or the raised hands function if you want to ask a direct question. But I first and foremost want to say thank you both. This was an amazing presentation. And I, for one, learned a lot. I loved just your lessons learned. I think that is really key. And for anyone who is not only wanting to do an initiative like this, but anyone who is engaging in an initiative that is being really mindful of community partnerships. And so thank you so much for sharing all of those. I think that's really critical. I agree with a lot of the same comments that are in here in the chat. So I will open it up to see if anybody has any quick questions, any questions they want to ask of our panelists. I'm scrolling back through the chat, making sure we didn't miss anything. I don't see anything missed. And I don't see any raised hands. So I'm going to ask for both of you. You answered kind of one of the things that I was really kind of thinking off the bat, especially when I was doing my introduction and thinking about the CDC funding piece. I'm sure that always, makes you a little nervous, but it seems like you have really been able to persist through that. Any thoughts about needing to change the name or anything like that? Or are you still going to be moving forward with all of that? Or is that a little bit of a kind of wait and see type of a thing?
With the name REACH?
Yes, with REACH.
So that's the name of the CDC program that we get funding from. That's their name.
Got it. That's their name. Okay.
So that's why she was saying, like, we're so shocked we still have funding because of the literal name of the program.
Everything, and that's their name. Okay, well, that's a moot point. Somehow.
No, we've gotten that question before. We, maybe we have. But to that point, we have, I was giggling a little during the video because, we're a small group here, but there was a little glitch in the video because our partner Natasha said breast and chest feeding, which is what we say, but publicly we can no longer say that. We've been told by the CDC. So we actually edited that out in some versions of that video. And I was like, oh, we didn't catch it in this video.
Yes. Nope. Yes, I know that has been, I've worked with other partners who I do a lot of work with with early childhood initiatives, which is birth to age 8. And we've been dealing with a lot of making similar changes to things as well. I do see a question in the chat. Andrea is wondering, what is the role of SCSU in supporting the program?
Yeah, that's a great question. And honestly, CARE still exists today because of SCSU. So in 2016, like the year or so prior, several of our funding sources had sunsetted, our grants. Our founding director, Dr. Jeanette Ikovics from the Yale School of Public Health, was moving on to a different role. CARE was at a precipice, honestly, and we were thinking about closing our figurative doors. And at that time, our dean, who happens to now be our interim president, Sandy Bulmer, and I were having conversations. She was interim dean, and so we had known each other for a little while, and we were just having a meeting like, hey, are there ways we can collaborate? And I came to her and I said, actually, I'm not even sure we're going to survive. And she was like, oh, well, we've been thinking about building, within the Health and Human Services College, something related to health disparities. So maybe we can just partner instead. So SCSU really came in and swooped in and saved us, funded my position at the time. And we really didn't have anything except for my position. And so we really rebuilt. And so since 2016, as Aisha mentioned, we've brought in more than $13 million. And of course, the university is very supportive in terms of grant services, pre-award services, post-award services, paying all of our community partners, which is a nightmare. We could have a whole other 45 minutes
Yeah.
on that piece alone.
Or more.
Can write a book about it. So yeah, SCSU has been really, really supportive and proud.
I think that's really great to think about, because so many times, I mean, I've been involved with a lot of conversations where you weigh the pros and cons. And I've been involved with a lot of community partners that have weighed the pros and cons when they've been faced with similar situations. And for you all, it seems like this was a real opportunity. And I'm so glad that it really has worked out for the best. And like thinking about it, I mean, that's been 10 years. And many times those types of partnerships can be really great. And then you have growing pains. And I think that really speaks to the true nature of the partnership and the reciprocity and the transparency, which you talked a lot about in this conversation. And that's critical. It's critical to these types of partnerships. And I know that can be a pain point as like, and you go, when you go through and work through these partnerships on all sides. Yeah, go ahead, Aisha.
And I just want to just share this piece because, like, I understand the question a little bit deeper around, like, where do we fare as an organization with the political climate changing and, you know, people being forced really to remove words like equity and such. And CARE is as an organization, our mission is to improve health equity, you know, in low income areas and specifically the Black and Brown community. So, I mean, Alicia, you can point the finger at me, but I'm the director now. So I stand on that and say, as CARE as an organization, we're not moving from that mission. We are still focused on the Black and Brown community because that's the community that is most impacted, you know, with chronic diseases. They're most impacted by different laws changing today. And it takes an organization like CARE to be consistent and to stand, you know, on our mission and make sure that we are doing the work so that we can be able to fill in those gaps, right? When we see things happening within the political climate where we can be of service.
I know we're at time, but just tagging on to what you said, I think that's one thing that you have done really, really well. And I know it was in the comments, like you have these amazing videos that tell the story really well and show your impact really well. And the things that you have done so well with your videos, but then also in this presentation is you have paired those stories, those really compelling stories with hard data to back that up, like, this is why we're not moving on that. And I think that is yet another example of not only the value of both programs, but why the partnership is such an exemplar partnership, because you have both, what I will say, the qualitative and quantitative data that you're pairing together, that storytelling with the numbers to back it up. And I think you've done really, really well.
And we have to acknowledge our partnership with Yale School of Public Health because they are the ones who really drive that research work. That is where our research work lands and through evaluation. So with each of our programs, there is an evaluation component. And I said earlier, you know, we want to be immersed in the community and not, you know, within the community with calculated, you know, plans or calculated purposes, but we do need to collect the data, right? So that we can build the story. And even in that, right, like with the evaluation team, we work with community members to help us with evaluation. Like they're learning with us. We're learning together. They're supporting us. We're going to collect the data. And that is what Alicia talked about in the beginning. We continue to do that. Like, as I mentioned earlier, I'm just looking at it and smiling. I studied that video when I got this job, and I'm still smiling because it feels so good to say that was 10 years or so ago or even more. And we are still doing the same things today with a modern take, but, you know, we're doing the same things today.
Yeah. And you're doing it with those principles that we all say of partnership, of community engagement, of all of that. Like, You are recognizing the expertise that the community has in all those ways. You are from your community partners, identifying the need, from them, representing them and recognizing them as expertise, like all of that. And that is what I love about this program. As you can see, I can go on and on. This is where I have my nerd hat and why I love these sessions. But I do want to recognize that we are a little over time. So I want to thank everybody for hanging in there with us today, for being a little over time, and to thank Aisha and Alicia for talking about the program. Thank you so much. As a reminder for everyone, you will get a copy of the slides, and I've asked Aisha and Alicia to send me the links for the videos that were so amazing. So we'll have all of that in our follow-up email, along with a recording of today's session. If you love today's session and you want to see the next sessions, please register for the rest of our Impact Awards series. Our next session is on Tuesday. Thank you so much. I'm Laura Weaver, and I hope to see you next Tuesday for our next session of Campus Compact's Impact Awards series. Bye for now.
Thanks, everyone.
Bye.
We appreciate the opportunity. Take care.